Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. We'll begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hi, everybody. Thanks to Terry Allen, Commissioner of the Cuyahoga County Board of Health, for being with me here again this week. I know it's an especially busy time for the board as school ramps up over the next few weeks. Now, I know this sounds like a broken record, but COVID's getting worse again. All of the counties in Ohio, except one, are experiencing high levels of spread, the highest category given by the CDC. While we want kids to be able to go to school in person, the more our numbers rise, the higher the possibility that school might have to go remote again. And it's not just schools. Businesses, restaurants, concerts, nightlife, all these things are again going to be affected if our positive cases don't start going down. I know Terry would agree with me that getting people vaccinated is the best way to beat this thing. And if you're on Medicaid, there's a special incentive. Medicaid is offering $100 if you get your vaccine before September 15th. That's right. You only have 2 weeks left to get that first shot and the money. Please do it. We at the county have made over 387,000 automated voice calls and sent over 265,000 text messages to residents who use Medicaid. That's over 500,000 messages to residents. To find out where to go for your $100 Medicaid bonus, visit covidvaxonthespot.com. And if you have questions or concerns about the vaccine, talk to a trusted expert like your primary care doctor. Please get vaccinated. Now, as COVID spreads, what can we do for fun? How about taking a walk or a bike ride? We have a wonderful asset, Lake Erie. I've said that my vision is creating walking and biking trails all along the lake, from one end of the county to the other. Some people have told me it'll never happen. Others have said it'll take forever. And I'll admit that it's a big idea, but it is happening right now. I'm not here to take credit or to say that the county is doing it all. Far from it. Lots of partners are making this happen. There's the Metro Parks, NOACA, the Sewer District, the Port, the cities, the Planning Commission, the state, and many others. But it is happening. Let's begin with some completed projects that you can enjoy right now. And that starts in Euclid, which has created a great model with a lakefront trail and a pier coupled with erosion protection. Along the west bank of the mouth of the Euclid Creek, Wildwood Park provides access to a marina, fishing pier, biking trails, and a picnic shelter. Wendy Park Bridge was just completed. This project and the Whiskey Island Trail were the final two pieces of the Federal Tiger Trails project. It created over 4 miles of interconnected bike and pedestrian trails and a new link to the lakefront. I was there just a few weeks ago, and it is a special place. In Lakewood, on Lake Avenue, we restriped the road and added bike lanes on the north and south side of the scenic thoroughfare from Cove Avenue to Webb Road. Over in Lakewood Park, there's the beautiful Solstice Steps, which have given Lakewood a spectacular landmark on the water. It's a great example of taking what used to be a construction and demolition landfill and turning it into something that everyone can enjoy. And we can't forget Wildwood Park, Edgewater Park, Huntington Reservation, Columbia Park, Rocky River Park, Perkins Beach, and Gordon Park. All are ready for you to enjoy. And there are also multiple projects currently under construction. Phase 2 of the Euclid Waterfront Improvement Project is underway. This project is creating a playground, beach house with food and retail, new residential development, and a public marina. What a fun place that'll be. The North Coast Harbor Pedestrian Bridge is also in the final stages of construction and will connect Voinovich Park in Cleveland by bridge right over the lake. This will allow for freer access across the lake to places like the Rock and Roll Hall of Fame and the Great Lakes Science Center. Work at Bradstreet's Landing in Rocky River is underway. This project will feature a pier extending out into the water, beach enhancements, erosion stabilization, and opportunities for play and exploration for all ages. Work is also being done to construct a bike lane on Wolf Road between Clegg Road and Sutcliffe Drive. And that's not the end. There are lots of projects that have been proposed that I'm very optimistic will be moving forward. In Euclid is the Beulah Park Euclid Beach Connector Trail. This will be a 1,700-foot trail that'll provide lakefront access for residents. Phase 1 of this connector will create public access connecting the Cleveland Metro Parks Lakefront Reservation and Euclid Beach, Villa Angela, and Wildwood. On East 185th Street, full rehabilitation of the street, as well as full streetscaping improvements will be done. This project would extend from the I-90 interchange north to Lake Erie. The Cheers study, which is working from Brattonall to Burke Airport, is studying the water and the shoreline to better protect it from erosion. It also plans to put more green space and pedestrian paths in the area. We're also improving the connection from East 9th to East 55th, also known as the Lakefront Greenway and Downtown Connector. This is a critical link to our Lakefront Public Access Plan and would also connect the Cheers study to the Cleveland Browns Haslam project. In tandem with this, the Haslam project proposed to the public just a few months ago would take the existing lawn at the convention center roof and extend it all the way past the Browns Stadium to the lakefront. This would allow for continuous green space and pedestrian space that would lead all the way to the water. And that would be huge, huge for the region. We're also in the early stages of development at the Gold Coast in Lakewood. After speaking with property owners and receiving letters of interest, we're exploring potential shoreline protection measures and trail connections in that area. Bike and pedestrian improvements have been proposed for the Clifton Park Bridge running from Rocky River to Lakewood. This project will provide safer active transportation alternatives to and from adjacent neighborhoods. Now, I was out in Bay Village with Mayor Kumar, and he has plans to make improvements to Cahoon Park with a focus on areas north of Lake Road. The plans would improve access and recreation in the park and would make long-standing improvements to the bluff. So as you can see, the projects that are done, being completed, and in planning right now cover a lot of the lakefront. A lot of the lakefront. While there's still a lot to do, creating lakefront access across the county is not just pie in the sky. We can do this. Couple all this with the Greenway plan's comprehensive trail system, including the towpath. And there are lots of trail connections throughout the county. And finally, I want to mention the 17 county roads running north and south leading up to the lake. We'll be working with NOACA to enhance those routes to enable residents throughout the county, even if not living near the lake, to enjoy our waterfront. This is all super, super exciting. By opening the lakefront to all of our residents, we'll be opening our future. Yes, it's a big vision, but together we can get it done. Thank you.
Thank you, Executive Budish. It's great to hear the projects underway. Certainly, we know that active transportation, physical activity is good for your health. We know it reduces risk for chronic disease, and it generally improves people's attitudes when you're out in the environment and have the opportunity to be by the asset that Great Lake Erie is here among the Great Lakes. So thank you for that. And also thank you for your support of public health and our efforts to continue to encourage residents to get vaccinated, because it is certainly our only way out of this pandemic. So as anticipated, we're amid a surge of cases of COVID-19, driven, of course, by the Delta variant that everyone's familiar with now, just as we're moving toward the fall and into respiratory illness season. So here's where things stand currently. Since late July, the number of COVID-19 cases reported to our office and to health departments across the state have continued to rise significantly. Per CDC, Cuyahoga County remains at high transmission of COVID-19 with about 189 cases per 100,000 population. There are data lags, and so our current number is actually much higher. It's in excess of 250 cases per 100,000. And you'll hear a bit more about that from Director Rush later. While lower than the overall state, our data is a bit lower than the overall state, has continued to move in the wrong direction over the last few weeks. So if you're unmasked and unvaccinated indoors and around others, your risk for contracting COVID is very high and will remain so throughout the fall and into the winter. If you're unmasked and unvaccinated indoors and around others, the potential for you to unknowingly transmit COVID is also a major risk. As Executive Budish noted, 87 of 88 counties in Ohio are now at high transmission. This is a very concerning development that has transpired in just a few short weeks in Ohio. It's demonstrating just how infectious the Delta variant is. COVID testing volume in the community has been increasing significantly over the last several weeks as cases increase and more people are seeking testing opportunities. And the percent of positive tests also continues to rise, and you'll hear more about that in a bit. Even more concerning, new hospitalizations for COVID are rising, as well as intensive care bed and ventilator use. This is exactly what we are trying to avoid. Sadly, and we are also bracing for increases in fatalities that may follow, increases in hospitalizations, intensive care bed use, and ventilator use. The Delta variant is no joke. It spreads very easily and quickly and presents an increased risk to everyone, especially those who remain unvaccinated. If you're vaccinated and unmasked indoors and around others, I'll repeat that, you can also get infected with the Delta variant and spread it to others. With Labor Day weekend coming up, CDC Director Rochelle Walensky said that people need to take their own risks into consideration as they think about traveling for the holiday. Because of the national Delta variant surge, the CDC now recommends that people not travel this weekend if you're unvaccinated. If you're staying home, we encourage you to follow the safest bet and celebrate outside. Go to the Lakefront, for instance, to reduce the risk for COVID transmission. And the weather forecast looks great for outdoor events this weekend. On the vaccination front, we're happy to report that we continue to make incremental progress in Cuyahoga County. Currently, over 57% of all Cuyahoga County residents have started vaccination and 53% have completed vaccination. Over 82% of those over age 65 in the county have been fully vaccinated, and this is important, as this age group is, of course, most at risk for hospitalizations and fatalities from the virus. We also know that 64% of those age 18 and over have been fully vaccinated, and 62% of those age 12 and older have been fully vaccinated. And we, of course, continue to our outreach and vaccination efforts in vulnerable communities and neighborhoods, as about 36% of African Americans and 44% of Hispanic Latinx populations have started vaccination, and we need to continue to do better and provide vaccination close to home for those folks in the vulnerable neighborhoods. And the data is very clear. Almost all the hospitalizations and deaths from the Delta variant are among the unvaccinated. We also continue to collaborate with the local foundation community and other government agencies, nonprofits, community health centers, hospitals, and grassroots agencies to spread the word about the many locations where vaccines are available. And vaccine is by far and away the leading public health prevention strategy that can slow and ultimately end this pandemic. They're readily available, and you can go to the gettheshot.coronavirus.ohio.gov or just call 211 to find out where you can get vaccinated. It's not too late. In fact, it's the right time right now. At our last briefing just 2 weeks ago, CDC had recommended that people whose immune systems were compromised moderately to severely receive an additional dose of the mRNA COVID-19 vaccines after the initial 2 doses. And this is for Pfizer and Moderna. They haven't yet put out any guidance for those that received J&J. This group represents among the immune compromised and at risk represents about 3% of the population. And given the particular risks that these health conditions pose, we recommend that these individuals contact their doctor to get their 3rd dose now as we enter the fall. CDC has announced that starting on September 20th, they're also going to recommend booster dose for certain populations that received Pfizer Moderna vaccine. And that they would recommend that booster dose 8 months after, starting 8 months after they finish their 2-dose series. This means that the initial groups that may be eligible for a booster dose are those residing in nursing homes, healthcare workers in our hospitals and other settings, and the elderly. And we're now awaiting the details and guidance from CDC's Advisory Committee on Immunization Practices on how the booster dose process will roll out. Vaccine is widely available, as we mentioned, and there are many providers in the community compared to the start of the vaccination campaign to assist with serving these populations as needed for the booster process. And of course, here at the Board of Health, we'll be working with our hospitals, pharmacies, community health centers, and the Cleveland Department of Public Health as we share the responsibility to provide booster doses and continue to offer 1st and 2nd doses in Cuyahoga County, which of course is the most important thing that we can do to get as many people protected as possible. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms, and we're seeing increases in testing volume, as I've noted, with the Delta variant in full force. Everyone with a known contact to someone with confirmed COVID-19 disease should get tested 3 to 5 days following exposure. It's important to isolate if you've tested positive for COVID-19 in the prior 10 days or are experiencing COVID-19 symptoms, and quarantine if exposed to someone who has tested positive, based on guidance from your local health department. These proven public health interventions are key to stopping the spread. We've been following them since the beginning, and it's prevented the worst that we could have seen in this community. A few weeks ago, in anticipation of the present surge of the Delta variant, we recommended that everyone wear a mask indoors around others to prevent cases, hospitalizations, and fatalities. We're seeing now more and more people heed this advice, as Ohio is seeing some of the highest COVID-19 case counts we've seen since last winter. Since vaccinated people that contract COVID may unknowingly expose their kids or other vulnerable family or friends, like elderly or immune compromised, masking indoors when around others is clearly the wise choice. This is particularly important in school setting, since children under 12 are currently not eligible for vaccination, and the Delta strain presents an increased risk for exposure to them and those around them. We're glad to see many government buildings, including county buildings, will be following CDC's recommendation as well, and we're seeing more agencies require vaccinations among employees to protect them, their families, and visitors in the work setting. We fully support the leadership demonstrated by hospitals, businesses, government agencies, colleges, and universities that have chosen to require vaccinations to help protect everyone. We've learned the hard way that masking is particularly important in the school setting. Recent reports of increases in COVID cases among students and staff in schools validate this prevention practice. Keeping kids in school and learning is always the best choice, and masking in the school setting is the best way to preserve this ideal. And also, it will reduce the potential for transmission of other respiratory infections in addition to COVID-19. In addition to masking, CDC recommends that schools maintain a distance of 3 feet between students to reduce risk. To help kids stay protected in the classroom, schools should also layer as many of the established prevention strategies as possible, including mask wearing, grouping students into smaller learning pods, hand washing and sanitizing, proper cough etiquette and sneeze etiquette, improving building ventilation, symptom monitoring and testing, and staying home when ill. Lastly, Please celebrate safely outdoors this weekend over Labor Day for all of us. Thanks for your time and attention. Now I'll turn it over to Director Rush.
Good afternoon, everyone. If we can bring up the dashboard landing page. Okay. So I just have a brief update as far as our data and the trends that we're currently seeing with COVID-19 cases. So over the past 7 days, we have averaged approximately 230 cases per day have been reported within our jurisdiction. And so that's over a 60% increase in the number of cases that we saw just from the previous 7-day average. And so basically what we've seen over the past 30 days, we've seen cases pretty much double pretty much every 2 weeks since the start of last month. And so it looks like our projections are showing that, we're set to have those numbers continue to increase. So we'll continue to monitor that. But definitely cases are rising pretty rapidly. The other thing I wanted to draw to attention is the new cases that are being reported within the past 30 days. That's different than what we were seeing just last fall. So children 0 to 19 years of age and adults 20 to 29 are representing the largest proportion of new COVID-19 cases that have been reported in the past 30 days. And so, earlier in the pandemic, prior to vaccination, we had the 50 and older population was the largest proportion of cases. And so now we've seen that shift to the other end of the spectrum with children and young adults being those that are primarily impacted or being infected most recently. And so in continuation of that with hospitalizations, so we're currently averaging, our 7-day average is 250 patients currently being hospitalized in the county for COVID-19. And so that's about a 16% increase from what we were seeing over the previous 7-day average, which is about 214. And so again, we're continuously seeing the numbers of hospitalizations increase. And also to coordinate with what we're seeing with the case trends, that same thing is happening with hospitalizations. So adults 20 to 29 are now the largest number of reported hospitalizations that have been people have been hospitalized in the past 30 days. So again, we're seeing much younger people being infected and also having severe outcomes resulting in hospitalization. For our deaths, we still remain at about 2% for the number of deaths that are being reported as a percentage of cases. And so we have over 2,200 cases overall, or deaths, I should say, that have been reported in the county. And so that's pretty much remained stable, and likely a lot of that is attributed now to more of our older population being vaccinated. So we are avoiding the severe outcome in relation to death. As Commissioner Allen had mentioned, we're still in a high level of transmission for our county as far as the Delta variant being the dominant strand, which is much more transmissible than other previous strands of the virus. So we can go to the testing tab here on our dashboard, which is the last tab. And so what we're seeing as far as positivity rate, overall CDC is reporting that we're at a 7% positivity rate. It looks like it's taking a little bit of time for that to upload. But if you just look back over, just even if we look at data from even a month ago, 2 months ago, we were less than a 1% of a positivity rate, although we had less tests being conducted. But as you can see, there was much lower activity. And so now you can see that trend line at the very end of the trend line, you can see where we jumped over 5% positivity now. Like I said, CDC reports close 7% positivity. So definitely we've seen a really sharp increase in the number of the positivity rate that we're seeing within the county. And again, we're paying close attention to those numbers. If you recall, we're still under where we were at the very peak of this going back into October, November. You know, our positivity rates were in the double digits. So we were seeing 15-20% positivity rates, but the trajectory that we're going on, we're climbing much faster than we were from the previous fall. And so keep in mind, you know, schools are just beginning to start back, and with our cases and hospitalizations trending younger, this is something that we're definitely concerned about in relation to the rate at which our cases and hospitalizations are climbing over the past 4 weeks. We can go back to the main landing page. And so overall, as you can see for the county, we've had over 88,000 cases reported in total. And so we're, of course, encouraging that, you know, people just start to go back to those same prevention measures that we've had in place: mask wearing, social distancing, you know, ventilation if you're indoors, and ensuring that that's in place. So this is something that we're, of course, going to continue to pay close attention to as we move into the fall with schools returning. So those are the highlights that I wanted to present for the team. So that's all I have, and I will turn it back over to Commissioner Allen for any questions. Thank you.
Okay, thank you all for your remarks. We now have a few minutes for some questions. Just a reminder to please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can take a question.
This is Lisa Ryan from WCPN Idea Stream, and I'm wondering if the higher hospital bed usage in Northeast Ohio, is that affecting hospitals? Can you talk a little bit about what that looks like on the ground, and if they're having to, you know, I think last year they had to move aside some beds and change their floor plan to accommodate. Is that happening? Do you know anything about that?
Thanks for your question, Lisa. So yeah, and last winter, there were some adjustments that hospitals made around elective surgeries and a range of other considerations. At this stage, we're hearing that they still currently have capacity, but it's really a combination of things that we're facing. You had the pent-up demand for delayed care that hospitals have been actually dealing with, community health centers that have been dealing with really since things were shut down. So there's a lot of catch-up on prevention care and other emergent or chronic issues that people need assistance with. In addition now to the increase in COVID cases, and when we enter the normal fall during respiratory season, we also will see flu impacting hospitals. So it's the confluence of these issues that they'll be facing. We haven't heard as of yet that they've reached the point where they're having to look at elective or other non-essential processes, or at least non-emergent processes to address and to cut back on. But we're going to continue to talk with the hospital systems, and they, of course, are a great partner helping us to understand what's happening on the ground in their systems, in addition to the range of other partners. So we'll keep our beat on the data as it emerges, and our ear to the ground to see if any changes may be required based on what they're seeing.
Great. Any other questions from the media? All right. Well, thank you all very much. Go ahead.
I would ask another question if we have time.
Sure.
Yeah, I'm wondering if Terry, are you hearing of any of your staff members facing hostility about trying to enforce any sort of, of these guidances like masks and vaccines? And have you experienced any sort of turnover at CCBH because of, the stresses put on employees?
Well, thanks for the question, Lisa. And I'll first start sort of writ large. Public health across the entire country is tired. we've been